Okay. All right, great. Well, it's my real pleasure to be here. I want to thank the organizers for inviting me to this event. And I had the same reaction when I was first contacted by Kathy. I'm like, this is not my thing. I'm not an expert on soil and human nutrition. And my reaction was, we do a lot on food safety, but soil linking to human nutrition is not an area that I'm as comfortable with. Several emails later, I was convinced that I needed to learn more about this, and I wanted to learn more about this, and that's why I'm here today. And I regret I wasn't able to be here today. The dialogue, it sounds absolutely fascinating, but I'm really looking forward to the next several minutes we have here to really dig into the important regulatory and policy issues confronting us here today. As Kathy indicated, I'm the director of FDA's Center for Food Safety and Applied Nutrition. And this is a graphic that I use a lot when I'm out speaking about our mission. And we are the Center for Food Safety and Applied Nutrition. And the two are not siloed. In fact, they interact all the time. And we are very cognizant of the fact that health lies at the intersection of food safety and nutrition. And soil health is an obvious example of that complex interaction. I'm going to be speaking about that more today. As I alluded to earlier, when we talk about soil health at FDA, food safety has clearly been the major area of emphasis. And you're going to hear some of those examples. Keeping potentially dangerous contaminants out of the soil keeps them out of the plants that grow there and enter the food supply. But I can see that that focus can expand to include the relationship between soil health and nutrition, nutrition in plants, nutrition in animals that eat those plants, and nutrition in people. And we are interested in seeing further study in this area of emerging science. And I have both personal and professional reasons for wanting to know if there is a way that we can have a healthier and more nutritious food supply through enhancing soil health. My background is in nutrition, in toxicology. These are all areas that are near and dear to my heart. My research career, 3 decades of research, was on nutrition and the important role of nutrition in preventing chronic disease. If scientific data can establish a way to reach a healthier food supply through soil health, I could see a future in which we can leverage our regulatory perspective to help make that happen. So now moving on to slide 2. In preparing for this panel, I was asked to address several questions about FDA's role in soil health and food safety and nutrition. And in thinking through it, I came up with this graphic, and I'm going to give you some examples of the way that we think about soil health at the FDA. And you can see I'm going to work around this circle, starting at the top with soil. And as I indicated, food safety is a big area that we are heavily engaged on related to soil. And that's because things like grains and produce can will come out of the soil, and what's in those will reflect what's coming from the soil. We're concerned about things like microbiological contamination, and I'll give you some examples there. We're also concerned about chemical contaminants. I know you've been speaking about things like lead and arsenic. So those are all areas in which we're deeply engaged. And while I don't sit in a lot of meetings like Bruce on soil, I sit in a lot of meetings on toxic elements and contaminants and how do we address these problems. From a nutrition perspective, this is really important because what we're doing is we are growing commodities that are really important to public health. And we want consumers to be confident in the safety of produce and confident in the safety of grains. And if there's a lot of headlines out there about outbreaks or inorganic arsenic or whatever, that undermines consumer confidence. And if consumers are not able to follow the dietary guidelines, which emphasize things like fruits, vegetables, whole grains, if they can't do that because they lack confidence in the safety of those commodities, then that hurts nutrition in this country in a very meaningful way. And the icon there is the healthy plate icon. Half the plate should be, be composed of things like fruits and vegetables with a heavy dose of whole grains. And that's how we get to better nutrition. And so that's the FDA cycle that we've been working through to get to better nutrition through soil. But you can see the little red dotted line that I included there as well, and that is the direct role between soil and better nutrition through altering the nutrient content of plants, things like that. And that's an area that I would love to learn more, and I'd love to see more science really to help build up that piece of the cycle. So in terms of some of the questions we were asked to consider, the first one is, what do you think are the component parts of international and US policy to promote soil and human health? Well, I would say that cohesive policy begins with an awareness of the importance of soil health and the potential risk of unsafe or depleted soil to human health. And this conference here today is a very important step forward in raising that type of awareness. We know that FAO has identified soil contamination as among the major threats to healthy soil needed to feed the world's population. And concerns are increasingly being raised about biological pollutants, which include bacteria and viruses. FDA is addressing this very important issue as it relates to foods through the implementation of the Food Safety Modernization Act, or FSMA, that Kathy mentioned previously. We are also aware of the presence of metals in oil, like metals in soil, such as arsenic, cadmium, lead, mercury, and we monitor foods to measure the concentrations of these toxins. As shown in the slide, our work is really concentrated on addressing the presence of contaminants in commodities that may have worked their way into food through soil, rather than how soil quality enhances the nutritional value of food. But going forward, we have many research assets that we can bring to the table in all of these areas. For example, our scientists, many of them who are here today, are working in such areas as understanding associations between soil, crop, and human microbiome that may be eventually able to treat and prevent foodborne diseases. Additionally, research is underway to utilize metagenomic sequencing to better understand precisely what genes are present in the microbiome that may contribute to pathogen persistence and survival in soil and plant environments. This information could further inform our development of standards that are aimed at preventing produce contamination from the source, the farm. And areas of our food safety research have also touched on the nutritional value of soil and its effect on plant uptake of toxic elements. For example, cadmium is a heavy metal that is naturally present in the environment. That's of concern because cadmium is a carcinogen and can have toxic effects. Cadmium closely resembles zinc, which is a necessary nutrient, and plants, especially spinach and leafy greens, will readily take up cadmium if zinc is limited in the soil. Research conducted by the industry-led Healthy Soils Initiative a few years ago, done in collaboration with FDA, determined that adding zinc to soil significantly reduces cadmium uptake by the plant. The HSI report recommended that growers could effectively remediate their soils by adding zinc when cadmium levels are within a certain range and still safely grow produce. This is a good example of how progress can be made without formal regulation. In this case, FDA worked with industry on its own policy to address this hazard in both food safety and in nutrition. Next question, what policies are currently in place that promote soil and/or human health? From our perspective, the produce safety rule, which is part of the FSMA foundational food safety rules, is a really important policy that I want to highlight here today. This major policy and all of the regulations and guidance that have come from that will really set the stage for preventive controls in food safety. The compliance dates for large farms began this year, January of 2018. And what the produce safety rule does is it establishes science-based minimum standards for safe growing, harvesting, packing, and holding of fruits and vegetables that are grown for human consumption. The rule includes standards for the safe use and storage of biological soil amendments of animal origin. I'll just call those soil amendments from here on. Things like raw manure, and it sets treatment targets for safe utilization of treated soil amendments such as compost. The treatment processes must be scientifically validated to meet certain detection limits for pathogens like Listeria monocytogenes, Salmonella, and E. coli 0157H7. We are conducting extensive research on the safe use of raw manure, and in the meantime have referred growers to standards that have been set by the USDA National Organic Program, which are 90 or 120 days between the application of raw manure and harvest, depending on whether or not the crops come into direct contact with the soil. On chemical risk, FDA actively monitors the presence of metals in foods because at high levels, those can be toxic and present a risk to our most vulnerable consumers, especially young children. Because these metals often occur naturally in the environment or have gotten into the soil because of pollution or other uses like pesticides, they're hard to get rid of. The best we can do is work to reduce the health risks that they present, and we have a multidisciplinary work group of experts at FDA helping to shape our actions in protecting consumers. For some metals, we have proposed or established limits on their presence in certain foods, including infant cereals, fruit juices, and candy. For example, FDA published a draft action level for inorganic arsenic in infant rice cereal, along with consumer advice. Is the framework suitable to the task? Yes, our standards are the product of a high level of input from stakeholders, including growers and the produce industry. They are designed to be practical while being protective of public health. And they are living documents in the sense that we are continuing to change course as needed. The other point I want to make here is that federal agencies work together all the time. And we have international engagements as well. And as Kathy marched through all the different aspects, we are engaged in all of those activities. For example, many of our scientists are leading the codex processes, looking at things like toxic elements and the levels that should be established around the world. What actions need to be taken moving forward? For FDA's part, we're doing extensive research to build the strongest safety net. In the area of biological soil amendments, we are working on a risk assessment to determine how much consumer health is put at risk by the use of raw manure in the production of commodities covered by the produce safety rule. We've sought input from stakeholders and the produce industry, the animal egg industry, academia, other federal agencies, and members of the public in developing the framework for our assessment. The Produce Safety Alliance held 3 soil summits in 2017, which have been very useful to FDA in understanding regional practices, perspectives on the benefits of soil amendments, and concerns associated with the challenges of using raw manure, compost, and other treated biological soil amendments in agriculture. Earlier this year, we highlighted the FDA's efforts to address soil health and produce safety at the Global Symposium on Soil Pollution in Rome, which had more than 500 participants from around the world. We have concluded a major research initiative involving USDA's Agricultural Research Service and several state universities to develop a multi-year seasonal and regional data set involving the persistence of pathogenic E. coli and Salmonella in the growing environment. This data set will be instrumental in the development of a survival model as a major component of our risk assessment to inform future policy decisions on this issue. So in conclusion, I want to wrap up by highlighting that, as Dr. Wotecki indicated, FDA is responsible for about 80% of the food supply, and what we regulated is covered on this slide here. Our mission includes food safety and nutrition. Work we do through better soil health can have an important public health impact. For example, you can see highlighted in red on the slide now, this shows the components that would be most directly impacted by improvements in the nutritional status of soil and how that contributes to better nutrition in the commodities themselves. And while some products we regulate are less related to soil, those are the ones that are now grayed out on the far side of the slide here, there's a middle group that are still influenced by soil health. The nutrients that are found in an egg, for example, reflect the nutrients available in the hen's diet. We are one part of the federal system that is working to improve nutritional status of Americans with the levers we have. We not only work in partnership with the federal partners, we work closely with the state partners, including through a cooperative agreement program with the states on the produce safety rule, and we also work with the National Association of State Departments of Agriculture in a very close partnership. If soil health were to decline, and the nutritional status of the population as well, FDA's focus on soil health could shift towards a greater emphasis on soil health in relationship to nutrition. Foods grown in soil that are rich in nutrients and are as free as possible of contaminants, both microbiological and chemical, are good for all of us, and I look forward to seeing what role FDA can play in this important work now and into the future. Thank you.